I want to talk some more about unintended side effects and sedation. Slowed reaction time. Decreased levels of consciousness. And decreased ability to react. So it's not just reaction time, but to be able to respond appropriately to a given situation. Loss of consciousness or level. Actually, in this, it's level of consciousness. So they're not as alert. They aren't able to think about, 20 different factors at once. For example, in a deadly shooting situation. So that's, level of consciousness. And then what happens with withdrawal? What happens physiologically in the body with withdrawal from alcohol, opiates, sedatives, is that there's a tremendous release of adrenaline. Your blood pressure goes up, your heart rate goes up, you tend to have tremulousness, you tend to be very irritable and jumpy. So your reaction time actually may be faster. But could be an overreaction. You could jump at nothing at all. And of course that can be more dangerous than not reacting. You can be hyper aware of everything to the point of distractibility. So you may not be able to function on the 20 factors that are of crucial importance. You may be distracted by 100 different things going on that are superfluous. And you might be overreacting. All of this is a dangerous situation. We talked about heart rate before. Not uncommon at all to see heart rate over 100 just sitting there. And that's 100 beats per minute. So your resting heart rate may be faster than some people have when they're jogging. So it's not much of a stretch at all in a stressful situation that your heart rate becomes dangerously high. You're also at more risk for heart palpitations, skipped beats, etc. Again, because of the withdrawal. So all of these factors come into play. And when we talked about the performance factors that could trigger a fitness for duty evaluation, think about what's going on in a situation with addictive drugs. I'm going to go through it just quickly, but irritability, overreaction, triggering complaints, use of excessive force, loss of impulse control, irrational verbal conduct, and if you are under the influence, there's a disinhibition, even with pain medications or anti-anxiety medications. Basically, like being drunk, like having too many drinks and shooting your mouth off. Some people become more depressed. All of these addictive substances can and will make depression worse. So that if you are depressed in the first place, you may be much more depressed, thinking about suicide, joking about suicide, or joking about some tragedy. Tiredness or hyperactivity. And you get changes in eating patterns, obviously. But personal hygiene and health suffer, either from being under the influence or being in withdrawal and not being able to take care of yourself. Often when people are in withdrawal, say from alcohol, they will use more of their prescription drugs, like Xanax, like Vicodin, to compensate. One of my patients calls their Xanax margaritas in a pill. And so when they're at work, they can't exactly mix up a cold one, but they can discreetly slip a pill, and no one knows until they pass out at their desk. So all of these can alter behaviors in a noticeable way. All of this also can alter performance, say in a firearm discharge situation. And in talking with Dr. Turner about this today, he talked about counseling law enforcement and saying, you don't know if it's going to have a dangerous effect on you, but also you never know if tomorrow might be your day. And you might have to be as sharp as you can be. And in that situation, either under the influence or going through withdrawal, it's impossible to function at your best. And talking about withdrawal too, people have a decline in cognitive function that will last throughout the next day, certainly in the next morning. Often with age that gets worse, and after a hard drunk over the weekend, people may still have measurable cognitive defects through the mid part of the next week. It's not uncommon, of course, for people with alcoholism to miss work on Mondays. It's commonly referred to as my wife hates this phrase, Irish flu. Her surname is McElroy, and so I hope she doesn't see this. But that's what it refers to, and that's why people miss work often. But if somebody has missed work over and over and they're in trouble and they're told you better not miss work again, then they're going to come to work and be dangerous. So it's before it gets to that situation, an intervention needs to take place, and sometimes that will be uncovered in the fitness for duty evaluation. In the use of pain medications, of course, the symptom is pain. And if you end up using more and more pain medication to get relief from pain, you become more and more at risk for these unintended side effects. And also, they don't work very well. I've had patients come in with chronic use of pain medications who were in terrible pain, even though they were loaded. They could not use enough opiate pain medications, short of death, to control their pain. And basically, it was a fool's errand for them to take more and more of it. And yet they were still in significant pain. And the worst pain that I've seen involves devastating back injuries. There are several other sources of pain, but that seems to be the worst. And I have had patients who, although they continued to be in horrible pain, they could not take opiates, and they would not take opiates no matter what, because of what the opiates had done to them. And they learned how to deal with it with a combination of non-addictive medication and just intestinal fortitude, because the opiates stopped working for them. They were no longer their friend.